Don't forget to subscribe to the channel. Every 6 minutes, someone in Brazil suffers a stroke. That's 10 people before this video even reaches the halfway point. And here's the shocking part. According to recent health reports, nearly 73% of these cases are linked to the inappropriate or prolonged use of common medications, drugs that are routinely prescribed to older adults and even taken without much thought. What if the very medicine intended to help is silently increasing the risk of a life-altering or even fatal condition? This video is a wake-up call especially for those over 60 and their families. We're going to expose the truth behind 4 widely used medications that can drastically increase the chances of having a stroke. But more importantly, we'll also share safer, science-backed alternatives that could protect your brain, heart, and independence. Some of these alternatives are simple, affordable, and surprisingly effective. Before we dive in, here's something I want you to do. If you or someone in your family takes daily medications, type the number 1 in the comments right now. This is your way of telling us, yes, this topic matters to me. And if you've ever had a bad reaction or side effect from a medication, go ahead and share your experience in the comments. Your story might help someone else avoid the same risk. Don't forget to click the like button if you care about health and aging, and share this video with someone who needs to see it. Trust me, they'll thank you. Now, here's a warning. The most dangerous medication we'll talk about is revealed at the end of this video. It's one that's still being prescribed in many clinics, despite recent studies showing its serious risks for seniors. So stay with us, because at the end, we'll also share an important message that could completely shift the way you look at your health from now on. Let's begin this journey of awareness, empowerment, and prevention. In the next chapter, we reveal the first silent threat, a medication almost every elderly person has used at some point and one that could be increasing your risk of stroke by nearly 280% without you even knowing. Let's talk about one of the most commonly used classes of drugs among older adults, NSAIDs, non-steroidal anti-inflammatory drugs. These include familiar names like ibuprofen, diclofenac, and naproxen. Many people reach for these medications to relieve chronic joint pain, arthritis, or everyday muscle aches. They're easy to find, often over the counter, and seem harmless. But behind this convenience hides a serious danger, especially for seniors. According to a major study published in the New England Journal of Medicine, regular use of NSAIDs increases the risk of ischemic stroke by a staggering 280%. That's nearly 3 times more likely to happen compared to those who don't use them. But why are these medications so dangerous? It all comes down to how they work. NSAIDs block an enzyme called COX-1, which is responsible for producing prostaglandins that cause inflammation and pain. But COX-1 also protects the stomach lining and helps regulate blood pressure and clotting. When you block it for long periods, blood pressure rises, the blood thickens, and the risk of clot formation increases, setting the perfect stage for a stroke. This is exactly what happened to Maria de Conceição, a 67-year-old retiree who began using diclofenac daily for her knee pain. She never imagined that something so routine could put her life at risk. After a few months of continuous use, she suffered a sudden stroke that left her with partial paralysis. Doctors later confirmed that her long-term use of NSAIDs played a major role. But the good news is, there are safer alternatives. For pain relief, paracetamol acetaminophen can be a less risky choice when used in moderation. For chronic inflammation, natural options like curcumin from turmeric, omega-3s fatty acids, and even cold or warm compresses can help. Gentle movement, water aerobics, and anti-inflammatory diets also play a role in long-term relief without endangering your cardiovascular health. Now, take a moment and think, do you or someone close to you use these medications regularly? Let us know in the comments with a simple NSAIDs if this chapter spoke to your reality. And remember, this is only the beginning. In the next chapter, we'll uncover a completely different class of medication, one that's often given to calm the mind, but may be silently damaging the brain and blood vessels. Keep watching. Now we turn to a group of medications that, for many elderly people, have become a nightly routine. They go by names like clonazepam, alprazolam, and diazepam, commonly known as benzodiazepines, often prescribed to manage anxiety, panic attacks, and especially insomnia. These drugs are seen as a quick fix, but beneath their calming effect lies a disturbing risk, especially when used long-term by older adults. According to clinical data from the renowned INCOR USP Instituto do Coração da Universidade de São Paulo, elderly patients who use benzodiazepines face an increased risk of 190% for hemorrhagic stroke, type of stroke caused by bleeding in the brain. That's nearly double the risk. But how can something meant to calm the brain lead to something so catastrophic? Benzodiazepines alter the way the central nervous system works. They enhance the effect of a neurotransmitter called GABA, which slows brain activity and induces relaxation. However, in older adults, this can disrupt the delicate balance of the autonomic nervous system, leading to instability in blood pressure and a weakened ability to respond to stress. The result? Greater chances of blood vessels rupturing, especially during sudden changes in posture or during sleep. A striking case is Jose Roberto, 72 years old, who had been using clonazepam every night for nearly 6 years. At first it helped him sleep through the night, but over time, his blood pressure became increasingly erratic. One morning, after feeling dizzy and confused, he collapsed in the kitchen. The diagnosis, a hemorrhagic stroke. Doctors later traced part of the issue to his long-term use of benzodiazepines. Thankfully, there are healthier options. For sleep and anxiety, natural aids like melatonin, magnesium, valerian root, and passionflower tea can offer support. Mindfulness techniques, breathing exercises, and even CBTI, cognitive behavioral therapy for insomnia, have shown excellent results in improving sleep quality and emotional balance without harming the cardiovascular system. If you or a loved one relies on sleeping pills or anxiety medication, leave a comment saying, "I understand now." It's a small act that might help others recognize this hidden danger, and we're just halfway there. In the next chapter, we'll expose a type of medication prescribed for heart health but that can ironically set the stage for a stroke. Keep watching, especially if you or your parents take something to control blood pressure. Asterisk. Let's now uncover a paradox in elderly healthcare medications meant to protect the heart that can, over time, harm the brain. We're talking about thiazide diuretics, such as hydrochlorothiazide and indapamide, often prescribed to manage high blood pressure. These are among the most commonly used blood pressure medications in Brazil and around the world. But while they can help reduce the risk of heart attacks, they also come with a hidden cost, especially in aging bodies. According to a Harvard University study, older adults taking thiazide diuretics regularly may face a 175% higher risk of stroke. That's not a small margin. The reason lies in how these drugs function. They force the body to eliminate excess fluid and salt through urine, which helps lower blood pressure. But in doing so, they also deplete vital minerals like potassium and magnesium to electrolytes essential for proper heart rhythm and brain function. When these minerals fall too low, the result is electrolyte imbalance. This can lead to heart palpitations, muscle weakness, confusion, and in severe cases, sudden stroke or cardiac events. And because older bodies have a reduced ability to restore this balance quickly, the risks increase dramatically over time. Take the case of Antonio Carlos, a 69-year-old retired teacher who had been using hydrochlorothiazide for nearly 8 years. Despite controlling his blood pressure on paper, he began experiencing intense fatigue, mental fog, and cramps. One day, while out for a walk, he collapsed suddenly, suffering a stroke that left him hospitalized for weeks. Doctors later identified his chronic low potassium levels as a contributing factor directly linked to his diuretic use. So, what are the safer options? One alternative is to switch to medications like ACE inhibitors such as enalapril, which help regulate blood pressure without depleting key minerals. Additionally, natural strategies like reducing sodium intake, staying hydrated, and practicing light aerobic exercises can significantly support cardiovascular health without dangerous side effects. If you or someone in your family takes medication for high blood pressure, type BP meds in the comments. You might be surprised how many people are in the same situation, and we're not done yet. In the next chapter, we'll discuss a medication that's often seen as a lifesaver, but in reality, becomes increasingly risky as we age. It's a blood thinner still widely used by elderly patients, despite safer alternatives. Keep watching. Now we arrive at a medication that has saved countless lives, yet in older adults, has become one of the most delicate balancing acts in modern medicine. We're talking about warfarin, one of the oldest and most commonly prescribed or blood thinners. It's used to prevent strokes in people with atrial fibrillation, heart valve issues, or a history of blood clots. But here's the troubling truth. In seniors, warfarin can just as easily cause a stroke as prevent one. Recent studies have shown that elderly patients on warfarin have up to a 20% higher risk of hemorrhagic strokes, the kind caused by bleeding in the brain, compared to those using newer The problem lies not just in the drug itself, but in how difficult it is to dose correctly. Warfarin interacts with dozens of foods, medications, and even herbal supplements. The difference between a protective dose and a dangerous one is razor-thin. Was tragically true for Sebastião, a 74-year-old grandfather who had been taking warfarin for atrial fibrillation. Despite following his doctor's advice, one small dietary change, eating more spinach, rich in vitamin K, altered his medication's effectiveness. His blood became too thin, and within days, he suffered a severe brain bleed that left him in a coma. The doctors confirmed that his anticoagulant level had become unstable, something extremely common among seniors using warfarin. So what are the safer choices? Modern alternatives like apixaban and rivaroxaban don't require constant blood tests, have fewer food interactions, and offer more stable protection against clots. While they may be more expensive in some healthcare systems, many programs already offer them at reduced costs for seniors. Combined with a balanced diet, rich in anti-inflammatory foods, and supervised by a trusted physician, they can significantly lower stroke risk without the roller coaster of traditional anticoagulants. Now, think carefully. Have you or someone close to you been prescribed warfarin? If yes, write blood thinner in the comments to raise awareness. You might help someone recognize a risk they didn't see before. And don't go anywhere. In the next chapter, we'll break down the practical steps you can take starting today to move away from these risky medications and embrace safer, more sustainable options without sacrificing your health or your budget. Now that you know the risks behind these 4 medications, it's time to shift the focus toward solutions. Ones that not only reduce the chances of a stroke, but also improve overall quality of life. The good news is that, for many seniors, safer alternatives already exist, and implementing them is often easier than imagined. Let's start with the benefits. When patients transition to safer medications or natural approaches, many report better blood pressure control, fewer side effects, improved sleep, and even increased mental clarity and energy. And for those who adopt lifestyle changes, such as reducing salt, moving daily, and using targeted supplements, the results are often profound. We've seen people who, after years of struggling with dizziness or fatigue, suddenly regain vitality and stability, all because they moved away from high-risk medications under medical supervision. But how can you make this transition practically and safely? The first and most important step is never to stop any medication on your own. Instead, schedule a consultation with your doctor or healthcare provider. Bring the information you've learned here and ask them about newer options, alternatives, or the possibility of gradually tapering your current dose. Many physicians appreciate when patients are informed. It opens the door to collaborative care. Next, consider integrating natural supports into your routine. For joint pain, try turmeric or fish oil. For sleep, melatonin and mindfulness exercises. For blood pressure, potassium-rich foods like bananas, sweet potatoes, and leafy greens. And don't underestimate daily movement. A 20-minute walk, done consistently, can lower stroke risk dramatically. Worried about cost? You don't need to buy expensive programs or pills. Start simple. Cut back on processed foods, practice deep breathing exercises, stretch in the morning, or make herbal teas part of your evening routine. These are all low cost or free, and yet, they bring measurable health benefits over time. Now I want to hear from you. If you've already made some of these changes in your life or are planning to, type the word change in the comments. Your action can inspire others who may be hesitant or unsure. In the next chapter, we'll recap everything you've learned and offer one final, powerful message, one that could shift the way you view aging, health, and your future. And don't forget, there's an important message at the very end that ties it all together. Stay with us. Let's take a moment to breathe and reflect on everything we've uncovered so far. We began this journey with the startling truth that strokes, one of the leading causes of death and disability among Brazilian seniors, are too often triggered by medications we trust. Throughout this video, we've exposed the hidden dangers of 4 drug categories: NSAIDs, benzodiazepines, thiazide diuretics, and traditional anticoagulants like warfarin. Each of these, while commonly prescribed, carries significant risks when used long-term, without monitoring, or in combination with other medications. But knowledge is power, and now, you're armed with insights that most people never received. Even after years of medical visits, the core message here is not to create fear but to spark awareness and empowerment. You deserve to understand the substances entering your body and how they affect your brain, heart, and daily life. Because once you have clarity, you can take control. You can ask the right questions, explore alternatives, and make informed choices. Not just follow routines out of habit or pressure. So here's what we ask of you. If this video opened your eyes in any way, please click the like button, share it with someone you care about, and subscribe if you want more content that truly puts your health first. These small actions help this message reach more people who, like you, want to live long, well, and fully informed. And in the comments, tell us which of the 4 medications surprised you the most. Or simply type, "I choose awareness," to declare that you're no longer willing to be in the dark when it comes to your health. Because the truth is, it's never too late to change. It's never too late to ask better questions, to learn, to seek safer paths, and to reclaim ownership over your health journey. Whether you're 60, 70, or 90, your body responds to kindness, consistency, and conscious care. Now, in the next and final chapter, we'll answer some of the most frequent questions people ask after discovering these risks, and we'll also give you reliable resources and support tools to take your next steps with confidence. And remember that important message we mentioned earlier. It's coming right up. Don't miss it. By now, your perspective on medication and stroke risk may have shifted completely, but with awareness comes new questions, and you're not alone. In this final chapter, we'll answer the most common doubts people have after learning about these dangers, and we'll share reliable resources to support your next steps. One of the biggest questions we receive is, can I stop taking these medications on my own? The honest answer is no. Abruptly stopping certain drugs, especially benzodiazepines or blood pressure medications, can be dangerous. Your body adapts to their effects, and quitting without guidance can lead to withdrawal, symptoms, rebound, pressure spikes, or even seizures. Always work with a doctor to create a tapering or transition plan. Don't rush. Safe change takes time. Another question is, what if my doctor refuses to consider alternatives? It's more common than you think. But remember, you have the right to seek a second opinion. Bring recent studies, like the ones mentioned here, and ask your physician to evaluate risk versus benefit, especially if you've had side effects. Some doctors may not be aware of the newest research, or may simply follow outdated protocols. Advocating for yourself is not disrespected survival. Many also ask, where can I find reliable information to guide me? Start with trusted medical platforms like the Harvard Health Publishing, the Cleveland Clinic, or drugs.com, which offer plain language explanations about medication risks and interactions. In Brazil, Anvisa and the Ministério da Saúde also provide valuable updates. You can also look for support groups and communities of seniors who are transitioning to safer health routines. On Facebook, forums like Envelhecer, Consogui Aging with Hale, or Medicina Consente share daily tips and stories from people just like you. Now, if you've made it this far, type "I'm ready" in the comments. It shows that you've committed not just to watching, but to thinking differently, acting cautiously, and sharing this knowledge with others. And here it is, the important message we've promised since the beginning. You are not powerless. You are not too old to change. And no medication, no diagnosis, no doctor's label defines your future. The greatest health transformation always begins with a single step: awareness. Now that you have it's your life, and the lives of those you love may depend on it.